Great, perfect. Good afternoon, everybody, and welcome to today's webinar on the topic of tobacco, cancer, and the European Code Against Cancer. My name is Ginevra, and I'm a communications assistant here at the Association of European Cancer Leagues, better known as ECL, and I will be your host and moderator for today's webinar. This is the fourth in a series of webinars focusing on different messages of the European Code Against Cancer, which the ECL Secretariat and our Youth Ambassadors group co-organize with different experts. And with me today from ECL, I've got David Ricci, who's our Senior Cancer Control Officer, and Ariadna Feliu Josa, who's our Youth Ambassadors representing Catalonia. So I hope you are all well prepared and excited to hear more about smoking patterns, secondhand smoking, and smoking cessations interventions across the EU and beyond, as much as I am. And today's webinar is co-hosted with ISPRO, which is the Oncology Network Prevention and Research Institute. And we are very, very pleased to be having a presentation from Dr. Giuseppe Gorini. In terms of the agenda, I'll go over a few housekeeping items. Then I'll hand over to David for a few words about why we are zooming in on this particular topic today. Ariadna will give a brief overview of the European Code Against Cancer and our Youth Ambassador program. And then we're going to have the keynote presentations for about 30 minutes from Dr. Gorini. We will conclude the webinar with a Q&A and a short quiz just to test your memory and your knowledge and make it a bit more interactive. And then David again will wrap up the webinar with some concluding remarks. So just a few housekeeping items, if I manage to share my screen. Here we go. So this is a view-only webinar for you participants and attendees. So if you need to interact with us and if you have any questions, you will have to type it into the chat box, which will be at the bottom of the toolbar of your screen. After the webinar is over, on your browser, a short anonymous questionnaire will be launched, and we really do appreciate your feedback. So please just take a few minutes to give us some feedback on how we can make our webinars better. And just a reminder that this webinar is being recorded, so don't worry too much about taking lots of notes. You will receive a thank you email early next week with the recording of the webinar, the presentation slides, and also links to our previous webinars, which you see now on the slide on the right-hand side. Now that the logistics are covered, I'm just gonna quickly hand over to David.
Yeah, we said this is the latest in our series of webinars about the European Code Against Cancer, which, as many of you will know, is the best available evidence regarding actions individuals can take to reduce the risk of cancer. And the code itself has 12 messages. The first two of which are related to tobacco control. And tobacco is extremely important, not just for cancer, but for other forms of non-communicable diseases. And it's, in fact, the leading cause of preventable illness and death globally. So it stands to reason that we focus very concretely on this topic with the webinar today. And also it's very pertinent to note that there are two specific messages of the 12 from the code focusing on tobacco control. The second of which deals with the issue of secondhand smoke, which Dr. Gorini will also include in his excellent presentation he's lined up for us today, which we will learn more about current trends in this area, in secondhand smoke, and in general in evidence on smoking for individuals, but also some areas too that are not covered in the current edition of the Code Against Cancer itself, so in the areas of novel products. And finally, it's very time for us to talk about tobacco control, because we have early next year the 8th European Conference on Tobacco Health, which will be held in Berlin, hosted by our member, the German Cancer Society. So registrations are still open for people to attend this important conference. It's the leading European conference on tobacco advocacy and implementation science in Europe, and it's only held every 3 years. So it's really important, and especially being in Germany, it's very important country to have a tobacco control conference. And Last thing to say is the Young Professional Award for this conference, where we have special prizes available for young tobacco advocates aged 35 and under, is still open for nominations till 15th of December. So visit ecto.org, I think is the website, and you'll find out more about that. So thanks very much, and I hand now to back to Giuseppe.
Great, thanks, David. I'm just going to take a quick second to introduce Ariadna before giving her the floor. Ariadna is a PhD candidate at the Catalan Institute of Oncology, and she's currently working on several projects related to tobacco control, especially aimed at establishing evidence-based knowledge about the impact of tobacco control policies implementation, smoking cessation interventions in healthcare facilities, as well as the harmful effects of tobacco products. Ariadna also collaborates with the Catalan network of smoke-free hospitals, and we're really happy that she's been an active member of ECL Youth Ambassadors program since 2017. So without further ado, please, Ariadna, go ahead.
Well, thank you, Gina, for this nice introduction. As David has already said, the European Code Against Cancer is an initiative of the European Commission that focuses on informing people about actions that they can take to reduce their own cancer risk, and also their family members, trying to promote some recommendations that are based on the latest available evidence, scientific evidence, which is really important to be evidence-based. Also, this successful cancer prevention, as you can see on the screen, it not only requires these individual actions, but also needs to be supported by governmental policies and actions, for example, including these messages in the education system, also having in primary care and all this. Now, I would like to share with you one video that summarizes really shortly the 12 messages of the code. I'll try to share my screen if possible. So I cannot share because you're sharing, Gina. So.
Yeah, sorry.
Yeah. There I'll go. Yeah. Okay. Can you see the screen, right?
Yep.
So as you have seen here, these are 12 really short message, but really direct to the point, and then everyone can follow. So I would raise awareness on that, and please, if it's the first time you hear about this code, just go through it and try to share their recommendations, because they are really important, really easy, and they can have a really high impact on your health. I would also like to introduce the Youth Ambassadors group, which I'm a member of. And I would like to say that this group is formed by students and youth professionals from 34 countries from the WHO Europe region. And what we do is we try to work together to raise awareness on the importance of the code, the messages, but especially among the youth. And that's one of the reasons why we try to do this webinar, also to improve the knowledge and share the knowledge on these recommendations. During the past year, we've been doing several actions. We've done 83 of them. I'm not going to go through them individually. You can go to our website and there you can see all of the actions, what we've done, and a summary of them. But we have done 80 individual actions, which is quite impressive, and 3 group actions mainly during the World Cancer Day and the European Week Against Cancer, 2 dates that if you haven't marked yet on your calendar, please do, because a lot of institutions are doing things and you can learn a lot about that. And that would be it. And I'm ready to hear Dr. Giuseppe Gorini on the evidence based on smoke-free places. And
thank you very much, Ariadna. We are indeed very proud of our youth ambassadors, and we are now in the process of kind of counting how many activities were carried out in 2019, and we will share the results in an infographic on our website. Just allow me to introduce our keynote speaker, Dr. Giuseppe Gorini. Dr. Gorini is an associate professor of public health and a tobacco control epidemiologist at ISPRO in Tuscany, Italy. His main areas of research include tobacco control, public health, and cancer epidemiology, especially with a focus on the tobacco and other risk factors, as well as e-cigarettes and the monitoring of secondhand exposure and tobacco products use trends. He has received over 700,000 euros in grants from the European Commission, as well as a variety of public sector and third sector organizations to carry very important studies on secondhand smoking and tobacco control. And he has also been a partner, principal investigator, and leader of work packages of several research projects funded by both the European Commission and the Italian Ministry of Health. Last but not least, he's also a consultant of the Emilia-Romagna region, as well as of the regional section of the Italian League Against Cancer. And he's been designing and assessing 2 school-based interventions for preventing smoking and alcohol consumptions in teenagers. So Dr. Gorini, the online floor is yours. Please go ahead and share your screen.
Thank you very much, Ginevra and David, for the invitation. And now I'll try to share. You can hear me? Okay. You can hear me? Yeah.
Yes, indeed, indeed.
Okay. Okay, I share my screen. Okay. So, thank you to all for being here. Thank you, Ginevra. And I speak about tobacco and cancer. At the beginning, I introduced my institute and the European Code Against Cancer, but perhaps it doesn't care about this point because already Ariadna did a good job. Then I speak about youth consumption of cigarettes and electronic cigarettes in youth in Europe, but also in the US. Then I speak about smoking cessation, looking at particularly to the last WHO-MPOWER report, and then a few points on secondhand smoke exposure. My institute, the Oncology Network for Prevention and Research Institute, is located in Florence, is a public health research institute of the Tuscany region. The institute was born almost 50 years ago, organizing the cancer screening programs for Florentines. Then it became the leading center in Tuscany and one of the leading centers in Italy regarding cancer screening programs. And also we have been conducting a lot of research, prevention research on tobacco control, diet, and physical activity. Looking at the European Code Against Cancer, already Ariadna said a lot of things. So here only 12 icons that you can guess of the main subject. But anyway, I speak about the first two recommendations. So don't smoke and develop a smoke-free home for second smoke exposure. So let's move to the first point of my presentation, that is the use in youth, the smoking in use of tobacco, of electronic cigarettes, among youth. You can see here a trend of current smokers. That means smokers once in a month, at least one time in a month, in students aged 15 to 16 years old. This is the survey, 6 waves of survey. You can see here boys, girls, and those students. The ESPRO is an acronym that means European School Survey Project on Alcohol and Other Drugs. And it has been conducted 6 waves, and now it's ongoing the last, the 2019 wave. But here you can see that all the countries that of this survey, 25 countries, not only European Union countries, but also other European countries of the WHO region. So you can see here from 1995, looking, for instance, have a look to boys, for instance, that there was a very good decrease in all 25 countries, these blue lines, from about 35% in 1995 to about almost 20% in 2015. And many countries recorded an important decrease. For instance, Bulgaria, the highest level, red line here, but also France, the yellow line here, both in boys and girls, but also in Greece, this light blue, or Ireland. The Ireland, this line is the steepest, and the best, as usual, were Norway and Sweden. Norway is the light green here, and Sweden is this ochre line here. And they recorded in 2015 almost 10% of current smokers among these adolescents. Instead, the worst answer were Italy, unfortunately, because Italy, it's this brown line here, recorded a stalling on around 35, as it happened, for instance, in Croatia, this purple line, but also Romania here, this black line here. So in summary, many countries, a lot of countries recorded a decrease. Not all countries, in particular these 3 I already said to you. Then another slide of the ESPRO report 2015, that you can see the daily smokers, that are people who smoke at least 1 cigarette per day. So they are heavier smokers than current smokers, okay? And you can see here that, as we said before, that Italy, Croatia, Romania, and Bulgaria recorded the highest level. Instead, the lowest were recorded in Norway, Iceland, but also in Sweden and Ireland and Portugal, Spain and Belgium, were in Denmark were good as well. Instead, all Eastern European countries were not so good. We didn't record any data from UK in this last 2015 wave, in Germany and in other Eastern European countries. Moving to the now another subject, current vapors. So young people who used at least one time in a month electronic cigarettes. And I put here 3 countries in order to see different patterns of using different in adolescents of worldwide, in some countries in the world. In Italy, you can see from the Global Youth Tobacco Survey here, that is a survey that was developed by the CDC in the US, in students aged 13 to 15 years old. You can see that we recorded from 2014 to 2018 more than a doubling of electronic cigarette use among adolescents, from to 18%. But interestingly, this increase in Italy and occurred before that Juul entered the Italian market, because Juul, the nicotine salt electronic cigarette that is very famous for the epidemic in the US adolescents, in Italy entered the market in 2019. So this increase in Italy was not due to Juul electronic cigarettes. Instead, here you can find the other two surveys, the US survey, sorry, the National Youth Tobacco Survey in the middle school here and the high school here. And you can see that there was a big increase after in 2018. Look at, for instance, high school, a 21% of current vapers, and 18% in 2019. This is very recent data. And this was due to the fact that Juul entered the US market in 2017. So this increase was due to Juul. Instead, in England, another different patterns on consumption, because looking at this survey, the age youth from adolescents from 11 to 18 years old, there was an increase, almost a doubling, from almost 2% in 2014 to about 3% in 2018. But Juul entered the English market in the same year here in 2018. But in England, they didn't record any increase as it occurred, for instance, in the US. So I want that you highlight that it's the pattern of use of electronic cigarettes among adolescents is very different in different countries. So it's difficult to find a worldwide pattern. Okay. So move at one detail about Italy, putting together tobacco and electronic cigarettes. Here you can find 3 waves of the Global Youth Tobacco Survey. This data will be published in next month in Preventive Medicine Journal. Here you can find other users, these 3 waves, and current users. Okay, look at the current users part. You can see that in 2010, about almost 21% of adolescents aged from 13 to 15 years old were smokers, because in that year in Italy, e-cigarette was not available, electronic cigarette was not sold. So only smokers here, okay, the black area. Instead, in 2014, in Italy, you have to know that the electronic cigarette was available since 2012. So in 2014, there was a big change, because electronic cigarette entered the pattern of use of adolescents. In fact, here you can find that only tobacco cigarette users were almost 18%, okay, the black area. Then the stripe area is, here are the dual users. They use both products, tobacco cigarettes and electronic cigarettes. And then almost 3% use the only electronic cigarettes. And in 2018, there was an increase, more than a doubling of exclusive users of electronic cigarettes and of dual users, from 6 here from 9%. So looking at smokers, that are people here, the black in 2010, but also the sum of these 2 areas, the exclusive tobacco users here, but also the dual users, you can see here, look, my arrow here. You can see that there was a stalling from about 21 to about 20% here. You can see here the number. But if you look at users of any nicotine product, you can see that from 21 we went to 26%, and then 2018, 8% in 2018. So in some ways, this is not a good news, because the number of people who use a nicotine product, or tobacco cigarettes, or electronic cigarettes, increased. And you have to take into account that this gray area people, young adolescents are more likely to become smokers, even though they are only using electronic cigarettes. So this is something that we have to worry about. Okay. Then move at poly-use of tobacco products. In the US, it was already seen this use of different types of tobacco. This is from the GYTS in Italy 2018. I put here also not only electronic cigarettes and tobacco cigarettes, but also smokeless tobacco users. Smokeless, I remember too, that are snuff, that is the tobacco for the nose, the chewing tobacco, and the heated tobacco products, the new products of the Philip Morris or British American tobacco. You can see here that many adolescents use, for instance, this green area, use the three products, tobacco cigarettes, electronic cigarettes, and smokeless tobacco. So poly-use is becoming widespread also in Italy. I put here another slide with the other tobacco products. In Italy, many adolescents use pipes, cigarillos, and cigars. Not yet water pipe is not so common in Italy, as it happens already, apart from Lebanon and Egypt, but also in some European countries such as Germany or Austria and others. But you can see here that putting all even pipes, cigarillos, and cigars, but the poly-use is more frequent. For instance, others, that means these people who use these three products, one of these products, are all these colors. So this area here, so people who use, for instance, this pink area, that is the highest, is people who use the tobacco cigarettes, electronic cigarettes, and one of these products, pipes, cigarillos, cigars. So the poly-use of tobacco products, of many tobacco products, is widespread also in Italy, and I think in many European countries as well, as it already occurred in US, but also in UK and other European countries. So now I finished my part regarding youth, and I move to the smoking cessation, looking at this report that I suggest to you to read, because it's very interesting, because this last report on the implementation of the Framework Convention on Tobacco Control is devoted to offer to keep tobacco use. This is the cover. And so it's very interesting because it speaks in depth about smoking cessation. And I want to highlight some of the recommendations in the WHO report. The first I like to highlight is this one: prioritize population-level tobacco cessation approaches. And in this slide, you can see the first priority, and then the second, third, and the fourth. So the first is integrating brief advice for smoking cessation into a primary care. The second is providing a toll-free field line services. That means a phone counseling service according to the WHO guidelines for field lines. Then there is the third priority, is making intervention using social media, mobile phones, and other digital platforms available. And the last, but not the least, developing smoking cessation services and providing reimbursable medications. And moreover, there is an encouragement on research regarding mobile technology, artificial intelligence, and wearable technology, because using these devices, much more smokers begin thinking about cessation. Another recommendation I'd like to highlight of this report is this one: recognize tobacco cessation support as an essential component in universal health coverage. This is something that is linked to the first priority, the brief advice for smoking cessation. So this is a recommendation that all healthcare workers must be trained to offer brief advice. And the training should be part of all healthcare professional training curricula, not only for physicians, but also for nurses, for technicians, and for other all people who deal with work in the hospital or in an outpatient clinic. And the training can be achieved not with a very difficult course. It is enough a one-day workshop or even using an online training course. An example of an online training course is this one that was developed by WHO itself. You can find it in this website. This is the address. I suggest you to do this e-learning course. It's very simple, and it is divided into 6 modules: the role of primary care providers in tobacco control, basic of tobacco use and dependence, overview of brief tobacco intervention, and then it goes in details regarding the brief advice, the brief tobacco intervention. So asking, advising, and assessing readiness to quit, dealing with low motivation smokers, and assisting the follow-up. So it's very interesting. There are a lot of films, videos that you can describe how to speak with the smokers. It's very interesting. But this type of recommendation, the recognized tobacco cessation as an essential form for universal health coverage, is something that in the US and Canada have been already developed. In the US, the so-called opt-out approach is offering the smoking cessation to all smokers at every clinical encounter. And it became even an indicator of quality of care of hospitals. And in Canada, a similar approach of the opt-out approach was developed since 2010 with the Ottawa model for smoking cessation. You can find some information regarding the Ottawa model in this publication, Moon et al., Tobacco Control 2014. But anyway, it's an opt-out approach, so you have to deal with the smoking cessation with all smokers at every clinical encounter. Similar recommendations are reported in the last report of the Royal College of Physicians of the UK, but actually in no European countries an opt-out model for smoking cessation has yet been developed. So we need to go in this direction. And I have no conflict of interest regarding these tools. This is a software that was developed in Canada, and it is very useful in order to help clinicians in order to deliver a brief advice for smoking cessation. How it works, you can find more information at this web address. How it works, TELASC registers tobacco users, documents tobacco consults, and is optimized the software for desktop and tablet devices, and designed to help clinicians consistently deliver brief, effective tobacco consults. Moreover, it lets clinicians recommend the quit medication and document the quit plan. And based on the information gathered, TELASC is able to assign a smoker profile to each smoker. So, for instance, a very dependent smoker to nicotine, a very motivated or a low motivated smoker. So, in some ways, it is a profiling of the smokers. And then there is TELASC generates follow-ups for up to 6 months. So, using different tools here, the picture. Interacting voice recognition calls that is very widespread in the US. I think in many European countries it is not so used. But anyway, there is also secure email, text messaging, and a mobile app. And the follow-up algorithm and schedule are driven by the profile of the smoker. So, for instance, if you are more motivated, they call you more often, for example. And then the last manager is able to provide a timely triage. So that means to refer smokers to, for instance, the state tobacco pill line if exists. Or they can also be video conferenced with a healthcare provider using a module of TELASC. Moreover, is able TELASC to generate reports in order the managers of the hospital can assess the performance of all participating clinics in order to show that clinicians are able to provide smoking cessation intervention to all, or to offer smoking cessation intervention to all smokers at the hospital. Okay. So, looking at this new world in some ways, we know from Cochrane reviews that guidelines, internet-based interventions, and mobile phone text messaging recorded a moderate certainty evidence. Okay. Instead, for a smartphone application for smoking cessation, the evidence is of low certainty. And I think because a few randomized control trials are available on these devices. So we need more studies in order to evaluate this type of application. Here you can find the main references of the Cochrane reviews regarding these interventions. Now I'll move to some examples. This is the UK Stop October campaign and website. This is the one launched in 2012. And it is very interesting because it's a new way of delivering an advice to stop smoking. It is a sort of play. It is not so serious. There isn't a doctor that say you must stop smoking because you are dying and so on. And you can see here that people here are not all people, as it happened in Italy when people arrived at my age or more, 60, 70. They have, for instance, they have already a smoking-related disease, and they have to stop because they must stop because of their illness. Instead, here they are young people, 30, 40 years old, different type of people, of English people. And here you can see, sorry. Join the 1,000 taking part in the 28 Days October Challenge, and will help you swap the smokes for jokes. So it's a sort of play, a challenge that you can share with your friend. There are also some useful information, success stories, and I want to highlight that I am recommending the Stop October campaign, the first editions up to 2014, because afterwards the public health England began recommending in this campaign the use of electronic cigarettes to stop smoking. This is a choice that the UK did, but not all countries agree with this choice. But anyway, the first editions were very good, and I recommend to you to read, and they offered also free mobile app, free email support, and free text message support. If you look at the impact in this article by Brown, the group of Robert West, published in 2014, you can see that Stop October, the campaign, determined about 350,000 additional quit attempts in October 2012 in England. And so this was a 50% increase in quit attempts. And the cost effectiveness ratio was very good because it was about £400 per discounted life years in the smokers aged from 35 to 44 years old, people who participated in a greater proportion to this campaign. That costed about £6 million. But here is the French answer to the English one. So in 2016, France launched this Moi sans tabac campaign in this website, you can see here the address. Here you can see the advertising of the Quill line, another advertising the Quill line, in being about recruit, and the advertising of the app for smoking cessation, the smartphone app, and advertising of the paging, the Facebook page, in order to find these people who are stopping as you, and so some support from peers. And this campaign was one of the three components of the National Tobacco Control Plan 2014-2017 that was launched in France, with the introduction of plain package and increase from 50 to 150 euros in reimbursement for smoking cessation treatments. These three components determine the reduction of 1 million smokers in France. Good news. So I think this is a very important example. Then I have no conflict of interest with this app. This is a very interesting Israeli app that linked a smartphone app with a device, a wrist device here, that measures how many cigarettes you smoke every day. So you know your smoking statistics. You can compare your smoking habits to others. You can share with friends who want to stop or to reduce the number of tobacco cigarettes. You can get credit and incentives and set your smoking goals. So in some ways, it's a sort of, again, a sort of something that you can play with. It's not something only serious and very difficult, because as you know, for smokers, it's not easy to stop smoking. So you need something, some incentives, some friends who support you, or who are doing what is smoking as you, so to share the difficulties. And now I want to know how many time I have. Perhaps not many.
Don't worry, just go ahead. Yeah, maybe 10 minutes. Yeah.
Okay. Okay. I'd like to finish my presentation regarding smoking cessation, reporting exactly and with some link with my thoughts. What the WHO report reported regarding electronic cigarettes. So the last report here concluded that the ECL acronym can be applied productively to electronic cigarettes. How? The M for monitoring that was developed for tobacco cigarettes is useful as well for e-cigarette use. P for protect from secondhand smoke, the same for electronic cigarettes. So electronic cigarette users should be banned indoors, especially where smoking is banned. The O for offering smoking cessation. And this is a thought of mine, but it's very similar, or it goes more in details in comparison to the WHO report. But anyway, in a clinical setting, electronic cigarette delivered with behavioral support may work as a cessation aid, so at individual level. However, electronic cigarettes are not recommended as a population-level intervention, since electronic cigarettes are sold not only to smokers who want to quit, but also to youth and non-smokers. And this is not good. Moreover, dual use is not recommended, because we know that about 70% of the electronic cigarette users keep on smoking tobacco cigarettes, and this is not good, because you have to switch completely in order to electronic cigarettes in order to record the smoking cessation, a success. W for warning, and as for tobacco cigarettes, also for electronic cigarettes, health warnings are needed, especially on potential nicotine addiction. E for the advertising and promotion. So the same effective restriction on electronic cigarettes advertising, promotion, and sponsorship are needed for electronic cigarettes. And then VR for raised taxes is useful also for electronic cigarettes, because the taxes should be applied to electronic cigarettes to prevent uptake, particularly by young people and non-smokers. and then look at what the report reported about heated tobacco product, the new entry regarding smoking, regarding tobacco products. Speaking about products such as the one developed by Philip Morris, whose name is ICOS, but it's in some country, and the one that was developed by British American Collaborate is the Glow. This product contains tobacco and should be regulated like tobacco